So recently my mom had to start taking her blood pressure at home as advised by her primary care physician. And I thought how good an idea it would be to make a video for her and anyone who's interested in understanding high blood pressure a little bit better and understand the pathophysiology and what we actually do as physicians and why we care about high blood pressure, and then how to actually take proper blood pressure at home. And that's what we're going to learn about in this video today. So why is hypertension important? Hypertension is one of those things that might not kill you today or tomorrow or a month or a year from now, but it is really a cumulative effect over decades of time. That's how I think about high blood pressure in the average patient, is that it's something that we need to control over a long amount of time. It's the same, to me it is similar to eating healthy and exercising. All of those things won't change your life dramatically in one day, but it's the cumulative effect that's really highly impactful over the long term, decades of your life. Now, having high blood pressure, long term, from a cardiovascular perspective, can lead to heart failure. The reason high blood pressure causes heart failure over decades of time is that it is forcing the heart muscle to pump against a higher pressure than it is made for. So over time, the heart adapts to these higher pressures. It's kind of like going to the gym. If you lift heavy weights, your muscles are going to get bigger. Similarly, if the heart has to pump against a higher pressure, it gets thicker. But in doing so, it actually starts weakening itself. When it gets thicker, it's harder to supply itself with blood. And over time, it not only gets thicker going out, but it can also get thicker going in. So the amount of blood in each pump actually can go down. And over time, the heart tries to augment this by not only getting thicker, but then it starts to dilate. And in doing so, it can lead to heart failure and weaken itself over time. High blood pressure is also a risk factor for having a heart attack, stroke, and all-cause mortality. People who have high blood pressure are more likely to die of other things as well. And it's all about modifying the things that we can control. It's the cards you're dealt and how you play them. It's the genetics you have and your composition and your disposition to developing high blood pressure and all these other issues. But what else can you do to improve or decrease that risk? Just because you have high blood pressure doesn't mean you will have a heart attack. But if we could clone you and have someone who doesn't have high blood pressure, that person is less likely to develop a heart attack. So you go to the doctor and they measure your blood pressure. What are we going to do with the information at hand? So there are a few things that I always reiterate to my patients about blood pressure. And the first thing is that we never really make changes based on one reading. You know, over the course of the day, your blood pressure is going to fluctuate, and that's normal. It's going to be different if you're walking up a flight of stairs, if you just woke up from a nap, if you just had a big meal. But overall, we want to see that your trend is kind of at a normal level. If we see that you've taken your blood pressure 5 times every single day and it's always kind of normal, and then you have one reading that's really high and then it goes back to normal, we're not going to put you on a medication or change your management just based on that one thing. But we kind of want to see an overall trend of those numbers. The second thing that I try to reiterate to my patients is that blood pressure literature has had a moving target, meaning that even in the short period of time that I've been in medicine, there have been different major clinical studies that I've looked at what is the ideal blood pressure that we should be targeting for patients. The overall general consensus that I try to explain is that we want you generally closer to 120/80. Those are the numbers that we kind of want you at. Just like with many other things in medicine, some people run a little bit lower, and that's okay. If you're 110/70 and that's your normal, that's fine. 120/80, however, is what we found to be a good target to decrease possible complications of having high blood pressure. The third thing that I talk to my patients about is the systolic and diastolic, or top and bottom number, in blood pressure. I'm often asked which one's more important, and the real answer is that you can't take either one in isolation. You know, it's part of a moving dynamic and every patient's different. I'm not going to get into the minutia, but overall, if you're tracking your blood pressures, just take both of those numbers because you can't take either one in isolation. The top number is really the peak of the pressure that your heart is generating. And the bottom pressure is what is the pressure when it relaxes. Now, for the sake of brevity in this video, I'm not going to go into the minutia of what goes into account with the diastolic pressure. But if you have those questions, talk to your doctor about it. The fourth thing that I don't get into with every patient, but it's really individual specific, is sometimes there can be what we call secondary hypertension, or a reason that you have this high blood pressure. Sometimes there are metabolic conditions disease processes that we have to go into, further testing and lab work that we have to figure out in order to really treat you properly, and sometimes not just diagnose you with high blood pressure, but potentially a reason for you to be developing it. Often we'll look into this when it's a very young patient or when there's something else on physical exam, some clinical signs and symptoms, or something on lab work that tips us off. But often we don't go into a secondary hypertension workup for every patient. For trivia purposes, there are a few very common causes of secondary hypertension, and we always think about this when it is abnormal for this patient to be having high blood pressure, or if there's some other clinical signs or symptoms or lab work abnormalities that would clue us in to having a secondary reason for you to be having high blood pressure. Things like intrinsic kidney issues from birth. You can have a coarctation of the aorta or a very proximal narrowing of the aorta that causes very high pressures. You can have thyroid issues, fibromuscular dysplasia, renal artery stenosis, Cushing syndrome, pheochromocytoma, obstructive sleep apnea, renal failure, and hyperaldosteronism. Again, we don't look into all those different causes because frankly, it's unnecessary to do that for every single patient who has high blood pressure, but if we have a clinical reason to do so, we can look for a secondary cause of high blood pressure. Now I have to acknowledge every single patient's different, everyone has different comorbidities, and I'm going to take an example of a patient who comes to me in my office and the only thing that is going on is that they had a reading of high blood pressure. And let's take this example as a way to manage patients who have uncomplicated hypertension or high blood pressure. Now, I think anyone would rather have no information than incorrect information. And that is the reason why sometimes we will tell patients to take their blood pressures at home. When people come to the office, they get a little bit nervous, they're going to the doctor, and they can get what we call white coat hypertension, meaning if you check your blood pressure outside the hospital at home, it's normal every single time. And then when you come to our office, it's very high. So one of the first things that I do with my patients is sometimes I'll have them get an at-home blood pressure monitor. The tips that I give my patients when they're taking their blood pressures at home is to A, be consistent, to always take it at the similar time every day. So I often tell people when you wake up in the morning, take your blood pressure, sometime in the afternoon or in the evening, take your blood pressure. Mark down and document it somewhere. So you can write it down on a piece of paper, you can use your cell phone and put it in the notes app. Sometimes blood pressure cuffs actually come with an app that you can input that information as well. Second thing that I want patients to do when they come into my office, I want them to bring that blood pressure cuff. I just want to know what are the readings that you get at home compared to the readings that we get on our cuff in the office. It just helps me understand, is this blood pressure cuff really that accurate, and make sure that the tools we're using is giving us good information. Often blood pressure cuffs are very accurate, and most on the market, you don't need to spend a lot of money. You can go on the AHA website, which I'll link in this video, to look at which blood pressure cuffs have been pretty well studied and are approved. But generally, you don't need to break the bank to get a good blood pressure cuff. I generally just want you to use an arm cuff if you can versus a wrist cuff. I find that they're a little bit more accurate, nothing too scientific about that. And this third part is the most important aspect of taking your blood pressure at home, and that is the stepwise process of getting an accurate blood pressure.
This is the basics of how to take your blood pressure accurately. Essentially, before you take your blood pressure, you don't want to be too active or be doing anything, no caffeine, smoking, exercise, and you want to rest for about 5 minutes. You don't want to be walking up a flight of stairs and then go immediately take your blood pressure. You want to be resting for about 5 minutes and chilling in a seat with your feet flat on the ground and in a well-supported chair with a good, comfortable back. The other aspect is when you put on the cuff, you want to be at heart level. So your arm should be on a countertop. You shouldn't be holding it up. It should be about the level of your heart. Now I know I discussed that I would want an arm cuff, but I'm using a wrist automatic blood pressure cuff. And regardless of which type you use, you want to be quiet when you are recording your blood pressure because speaking during blood pressure readings can throw it off a little bit. Your arm should be completely exposed and you shouldn't do this over clothing. And then the last thing is that the blood pressure cuff itself should be a good fit. So make sure to read the back of it and make sure that the cuff itself is the right size because a falsely elevated or low blood pressure can sometimes be due to a cuff that isn't the right size.
So Mom, Dad, this is the information that I would want anyone who's taking their blood pressure at home to know, and the reason why having high blood pressure can be clinically important. Now, I know I didn't go into a lot of the treatments of high blood pressure, which includes sometimes salt restriction, exercise, improving their diet, avoiding smoking, and medications. But if you guys found this video helpful, I'm happy to make a new one where we go into some of those details.